Okay, so the last portion of this topic is going to talk about inflammation. So inflammation is when we're talking about a change in the tissues related to some type of agent or accident that has happened to them. So it's a response to your immune system, an injury, or not getting enough blood flow, which is called ischemic or ischemia, right? It can be rapid and nonspecific. Its primary purpose is to protect the body from whatever is irritating it. It can only occur where there's blood vessels, also known as a vascularized area, right? So classic things that we tend to see in response when inflammation is going on. Redness, swelling. If you touch the affected area, it's warmer than surrounding skin in other areas. It hurts because of the swelling. It usually puts pressure on the nerve endings. It can be discomfortable. And person who usually has inflammation in an area doesn't want to use it because of the pain, so they lose function. Right, you can have systemic reactions or systemic inflammation, like a fever, or you can have localized ones, like if you would hurt your finger and it swells up. Right. It's actually part of almost all of our disease processes. If you think of a disease that ends in itis, this means that it is caused by inflammation. So for instance, pancreatitis is inflammation of the pancreas. Appendicitis is inflammation of the appendix. Right? Gastritis is inflammation of the stomach lining. Right? It can be acute, means that it comes on suddenly, or it can be a long-term chronic issue. Right, there's different things that cause problems, all right, related to inflammation. We can see macroscopic effects of it, right, meaning large, right, so that's things that are easy to see. Redness, swelling, heat, pain, loss of function are hallmark signs. Microscopic is how it's going to impact small, tiny vessels and cells in our body. It's usually because of an inflammation at the site, right, of a cell, and that changes its ability to function. Mast cells are the cells within our immune system, right, that are our most important activator of inflammation. They respond to the initial problem or insult and then initiate the reaction that happens. They release chemical mediators or chemical signals, and the main one that they release is histamine. Right, once histamine is released, it's one of the first mediators in the inflammatory response. It causes, it acts on the blood vessels, so that means it's vasoactive. It causes constriction of the vascular smooth muscles, right? It causes dilation of the arterial vessels and increases the vascular permeability. So permeability means how easily things go in and out of a vessel or a cell, or how leaky essentially the membrane is that is on the outer edge. We're saying that when histamine acts on blood vessels, it makes it more vascular and permeable, which means it makes them more leaky, so it's easier for blood and fluids to seep out of them and into tissues. Plasma proteins also play a role. So there's 3 plasma proteins that are part of the inflammatory response. There's the complement system, and this gets activated by the antigen-antibody reaction, like if there's a pathogen in the body. There's the clotting system. Its job is to stop bleeding and localize any microorganisms that might have gotten in through like a cut or things like that. There's the kinin system, and this uses bradykinin and causes vascular permeability to change, smooth muscles to contract, and it often elicits pain responses. So one of the jobs of inflammation is to trigger cellular changes, like white blood cells or leukocytes to come to an area. So we have different types of white blood cells. For instance, there's granulocytes, and then there's also 3 types of granulocytes: basophils, eosinophils, and neutrophils. So neutrophils, they tend to come in early, right, in inflammation, and they're phagocytistic, which means that they're going to be the ones that are going to engulf and break down pathogens. Monocytes migrate to the inflammatory site, and they are kind of the precursor or hold the place for macrophages to come in. Macrophages come in about 24 hours later and replace neutrophils, and they also are phagocytostic, and they can survive and divide even in acidic and inflammatory areas. So they're more sturdy of a white blood cell to fight for defenses. Eosinophils are mildly phagocytic. They tend to get released as part of the vascular mediators from the mast cells. We see them a lot in allergic reactions. We also use natural killer cells. They recognize and eliminate things like viruses, cancer cells, or even abnormal cells in our body that aren't growing properly. We can also use platelets and platelet activating factor. These tend to trigger our platelets to come in and cause clots. They also enhance the function of neutrophils and monocytes. They are also a very potent vasodilator, so they're going to open up or dilate our blood vessels, which increases permeability of the blood vessels at the injury site and leads to things like swelling. Plasma is our main source of mediators. That's how they travel during the inflammatory process to different parts of the body. Cytokines, their job is to respond and bind with specific receptors on the targets that we're trying to attack in our immune response. Nitric oxide gets released as a byproduct of all this, and it tends to relax our vascular smooth muscles. It also reduces platelet aggregation, leukocyte recruiting, and microbial agent, and it can kill microbial agents by changing the gas components of our blood. Serotonin is also a chemical mediator that can be released. It works similarly to histamine. We can also have arachidonic acid metabolites. These get produced by our prostaglandins, and their job is to start slowing down or reduce the inflammation process. They can inhibit or potentiate parts or the effects of histamine. Right? Most of our medications actually work in this area that we use for swelling or pain. Things like aspirin, which is abbreviated ASA, NSAIDs, that includes things like Motrin or ibuprofen, and steroids. They are going to block this pathway, which prevents prostaglandins from forming and can control inflammation. Acute inflammation is early on. It's almost an immediate reaction to damage. Think about if somebody breaks a bone, they tend to have swelling very quickly after the injury. It's aimed primarily at removing the injuring agent and containing the agents, if any, have broken through the skin barrier. It wants to limit the extent of tissue damage by confining the problem. Right, it can be triggered by infections, immune reactions, trauma, or even chemical agents. It's usually self-limiting, and it has two stages, vascular and cellular changes. Vascular changes begin almost immediately. First, you have a constriction of small blood flow, and then you have a rapid vasodilation of the arterioles and venules in the area. So first you constrict to try and contain the problem, and then your blood vessels open up and dilate, and that is to get your white blood cells, platelets, all those things to the site to start battling the injury or the infection. What we see on the outside then is redness, which is known as erythema, and warmth at the site. We then have an increase in permeability, right, of our vessels, like our capillaries and our cells. This causes fluid to shift out of the cells in the capillaries and into the tissue. And what we see then is swelling, also known as edema. This also puts pressure on nerve endings in the area, which leads to pain sensation in patients. You can also, or the swelling also serves to dilute out whatever the offending agent is that's causing the problem, right? It wants to limit its potency, essentially. Right, inflammation in the vasculature, just to sum it up. So first we see our arterial vasoconstriction, followed by vasodilation, that's to control our bleeding, right? Next we see cell damage. So this is where we have an increase in capillary permeability, which leads to plasma leakage, and because of that our sequela is edema. Alright, here's a video. If you'd like to see a further explanation, you can click on the link in the PowerPoint to watch it regarding inflammation. The clinical manifestations we see of inflammation, we can look at the signs and symptoms. So systemically, we often see a fever. We see an increase in our white blood cell count. That's called leukocytosis. We see an increase in our ESR rate, or erythrosedimentation rate, an increase in our CRP level. This measures inflammation in the body. Right, the lymph nodes can be enlarged in that area. Patients are often feeling lethargic. The acute inflammatory response can differ from the immune response depending on the effects inflammation has. Right. So summary, again, this is on the other video, but or on the other slides. Vasodilation, what we see because of that is redness in the area gets hot. The vascular permeability changes, that gives us our edema. Cellular infiltration happens because of the neutrophils. This is what forms pus. So if you see somebody has purulent drainage or pus in a wound, that is actually from the neutrophils attacking the pathogens. Platelet aggregation happens to form clots, right? And stimulation of the nerve endings gives patients pain as part of the acute inflammatory response. Chronic inflammation, on the other hand, is going to happen over time. It can last for weeks, months, or even years in some patients. In this response, what happens instead is that the macrophages and lymphocytes react instead of neutrophils that occur in acute inflammation. It also triggers increased replication or proliferation of fibroblasts. Right, these are usually cells of connective tissue that produce fibers, so then we have things like scarring or adhesions that form as part of chronic inflammation. Right, this can lead to changes in organ and tissue shape, which can cause problems down the road. There are a variety of causes that can lead to chronic inflammation, things like persistent irritants like exposure to smoking, chemicals, things like that. Chronic stress can lead to it. People can be resistant to the phagocytosis process, and it can also be a result of autoimmune disorders. And if you take any of your devices, like your tablet or your smartphone or your laptop, and just do a quick search about autoimmune disorders, you'll often see that they're, one, chronic, and that, two, they're caused by types of inflammation. Like, for instance, multiple sclerosis is a chronic problem where there's chronic inflammation that causes damage to nerves in the myelin sheath that coats them. Right, this maps up the modifications in self-defense or mechanisms of self-defense section for you. Feel free to email or call if you have any questions or concerns.